My name is Dr. Baldev Sanghera, and I've been in practice since 1997. I've been an EMR user since 2002. Initially, I used Health Suite plus Purkinje, and I switched over to MedAccess, the PSP, ASP version in 2008. Initially, when I first took over my practice in 1997, I took over a large practice based on paper, and I found that managing the charts was quite hard. Receiving reports, filing them, and tracking the paper charts was hard and awkward sometimes. And also reading the older physicians' writing was often impossible. And so I had to do something that was a bit more efficient in registering and recording things, as well as finding old reports, finding new reports, not losing any reports. And that was best achieved by switching over to the EMR. The EMR has actually enabled me to make my workflow more efficient than before. I don't have to search for charts. They're right there with me at all times. I can discuss results with a patient and provide them with an examination and then a prescription. We place our printers outside of the exam rooms, not inside. So when I'm ready to print off a prescription and end the visit, I get up, open the door, reach outside the door, prescription's there, and I hand it to the patient at the door. The patient also realizes that when I've handed them a prescription, that's the end of the interview. And if they need to discuss other things, they can rebook later. The system has to be scalable because we always have to build in that future ability to do more. And currently, right now, I've found that MedAccess, whatever I wanted to do, it can. It's just whatever I have time to learn to do. That seems to be the limiting factor. The support staff are always great in teaching us whenever I've called them up and I said, how can I do this? How can I do this? And they've been quite helpful along the way. Well, I think I would recommend moving to the MedAccess EMR simply because of all the different things that it can do. It will improve your professional capabilities and hence your professional satisfaction. You will be able to provide more balanced care. You will be able to provide better follow-up for your patients. It will increase your income by allowing you to capture more of the chronic disease bonuses, and you're still able to get home on time even though you're doing more. You also will save money in the longer term by maybe changing where the staff will be deployed.